Dear colleagues and friends, I'm Ramin Tadayoni from Paris University, and thank you for having invited me to talk about a new OCTA technology. Here are my financial disclosure that include Zeiss that will be cited in this presentation. When OCTA is an amazing machine allowing exploration of retinal circulation, its resolution is not still as good as histology, and this explains some differences between the two methods. Here I'm going to talk about a new OCTA technology that the code name is beam expander. This technology is used combined with the prototype software in the Plexelate 9000 developed by Zeiss. We will see the contribution of this new technology to retinal vascularization exploration and also to choricapillary exploration. Beam expander basically expand the beam somewhere in the pathway of the light, but the consequence is, on the contrary, a narrower beam at the retinal level. You can see it here. The diameter of the beam at the retinal level is half the normal beam size, and this allows increase in lateral resolution of the images. And this could explain how we can have, with this technology, images that are closer to what we have in histology. Images obtained by this technology can be segmented and also depth coded with the prototype software. When images obtained by the beam expander technology is already amazing, the first thing we did is to see if averaging them could even further improve the images. And as you can see here, averaging indeed increase the linearity of vessels and increase the contrast and make the image more informative. So we are going to use this averaged image here for comparison to traditional technology. Here are our method. We had 22 healthy subjects imaged with and without the beam expander OCTA after all required authorizations. We did qualitative analysis, comparing image of a superficial capillary plexus, deep capillary plexus, and choriocapillaries, and also quantitative comparison of perfusion density, vessel density, and foveolar vascular zone. For the image quality, we try to be as objective as possible, asking our grader to grade a score for each images. Of course, the grader were masked. They didn't know if it was with or without this beam expander technology. And these are parameters they graded to have a score that allows us to measure the quality of images. The qualitative analysis of images shows that the average retinal angiogram with beam expander are better than the average standard images. In terms of FAZ definition, vessel sharpness, but also the image in the periphery, because as you know, usually the quality of the image decreases in the periphery. And all these parameters are significantly in favor of beam expander. Here you can see an example. So in the right side, you have the regular OCTA. Here the beam expander OCTA, not yet average, and you already see the differences in some area in the resolution that improve the visibility of vessels. And you see also that the size of capillaries go closer to what's in histology, and this is also due to this increased resolution and better imaging. Our software allowed us also to measure the usual quantification we do on OCTA, and here I will present some of these results. We compared the quantification by beam expander compared to the standard OCTA, and here there was a difference due to the improvement of the images, and indeed the mean vascular density was significantly higher with beam expander compared to standard angiogram. The FAZ circularity was found to be significantly lower. And of course, a very important parameter is the repeatability. And in all these parameters, the repeatability was higher with beam expander, significantly higher. For example, for vascular density, 0.662 compared to 0.439 with the standard technology. And this is very important to be able to compare measurement and to be sure that the measurements we are doing are reliable. As you know, imaging of the choriocapillary has improved these last few years due to SWEP source use, but also ways to control artifacts. But still, it's very difficult, and there is a lot of artifact, making the exploration of choriocapillaries somehow uncertain. As the resolution here of the OCTA is improved by the beam expander, we also try to measure this on choriocapillaries. And as you can see here, clearly the beam expander improved the quality of image compared to the standard technology, and it's much easier to see flow voids and the capillary structures. The capillary structure and the voids that we see with the beam expander are quite close to what has been described in histology. So here again, we go even closer to histologic analysis of the circulation and vessels in the retina. We didn't do any quantitative analysis of choriocapillaries because of the lack of consensus on any measurement at this level. But it was obvious that images were closer to histological images, and the improvement of quality of image for choriocapillary is even more impressive than in the retina. Another limitation could be that we only did this imaging in healthy patients, but of course this is the first time this technology is tested. So this is a pilot study, so it needed to be done first in healthy patients. Then now that we have all this information, the next step is of course to go to diseased cases. In conclusion, the increased lateral resolution with beam expander improves the image quality, as you can see again here, provide a more reliable flow quantification, especially in deep capillary complex where there is usually more artifact and the resolution is more critical. There is an improved choroidal images, as you can see here, which is of great potential. So all this data warrant investigation of the beam expander utility for exploration of macular pathologies now. I would like to acknowledge all the people who has contributed to this work from our teams at Université de Paris, Lariboisière, and Fondation Rothschild, but also at Karzais, Medicaid, and you have the list of them right here. Thank you very much, and goodbye.